Parliament at all levels, CSOs, partners, traditional institutions and religious institutions, the people of Nigeria. All of us are interested in ensuring that we have good health. And if you are to have good health, it's not just by talking or by mouthing it or by whatever it is, it's by doing the hard work to be able to tell the story in such a way that that story can be verified. And having good health in Nigeria, there are so many things that are involved in having good health. There are things we call social determinants of health. Health is multi-sectorial. I'm just coming out from somewhere now where I had a meeting, we were discussing road traffic accidents. Road traffic accident has a component of health, but really, the component of health you have is reactive health, curative health. The preventive health is more from Ministry of Works. If they do the roads, people will not have accidents. So all those things are there, but for Nigeria to start to experience good health, it's also known from all international conventions and documents that the focus should be on primary health. And primary health, we should be talking about the women and children. But once you start to improve the lot of women and children, you're improving the lot of the people who are producing us, and you're also improving the lot of people who will replace us. And once you do that, you start to contribute or start to lift the indicators of the system. So the work we've done, like Eze said, is rather than being reactive, because what we used to do in the past years is to do what we call expenditure analysis, budget analysis, and all those things when the cat has left the bag. But this time we decided that we should be part of the process because we are Nigerians. So we want to put forward to government what the CSOs, as Nigerians, all these CSOs are Nigerian CSOs, they are owned by Nigerians. The list that you have here is about 75, but actually the membership is beyond that. CSOs working in health sector. That we can have that conversation where everybody is putting the ideas on the table. So we look at all these ideas and be able to pick the ones that will help Nigeria. We used to talk about MDGs. We are now talking about SDGs to achieve the SDGs. Nigeria never achieved the NDGs, and Nigeria should be able to achieve the SDGs. And to do that, proactivity is required. So that proactivity is what we are talking about. So what we have done is, when you look at the document we are not looking at the whole health budget. Because if you are looking at the whole health budget, you'll be talking about tertiary institutions and all those things, secondary institutions. The proposal here is actually focused on service delivery component of health budget in the Nigeria, especially at federal level, and targeting those areas that will help Nigeria achieve the SDGs. And we are looking at the service delivery component of those things. I'm sure one of us will be able to read this out to you. But the key things is that we are looking at the systems, we are looking at the things like immunization, mother and child, and all those things. What we can do to make sure that the things that are preventable, that are making them to suffer, and making us to bury them often, that we can stop them. And we can stop them if the government reorders the priorities in terms of health. Because it's not that the money is not there, the thing is just what are you using the money for, and what is he paying for. If all of us can agree on what we want to use the money for and what we want to use it to pay for, and effectively and efficiently monitor the utilization and the results. I'm sure this country in the next 5-10 years will be doing better in health giving. Thank you.